Hi, I'm Maynard Eaton, Executive Editor at Southeast Region News. Joining me now for our Politics 411 Newsmaker segment is six-time State Representative Pat Gardner, a seasoned and savvy and sophisticated lawmaker who's now running for re-election in District 57. But it seems like, Ms. Gardner, that the Republican Party wants to make you an extinct sort of legislator. They're trying to, an endangered species, if you will. What's going on with this manufactured, gerrymandered 57th district?
Well, it is an odd-looking district. It looks a little bit like a snake, but the objective of the Republicans was to gain a two-thirds majority in the House and the Senate while they still can. And they also had to comply with the Voting Rights Act, which means they had to create or not diminish the number of African American or minority districts. So they ended up creating more minority districts than they really needed to. And the result was that they put some colleagues together in the same district. So there are two Democrats, one African American and one white, that are in the same district in a large number of places. And frankly, at least four of the Democrats who are being eliminated are white women, which is pretty frustrating. We think we're a multiracial, multicultural party. We want to continue to be that way, and the Republicans have really turned this into a difficult situation where we run against our colleagues, which is not very much fun.
And you say this is by design. This is not happenstance.
No.
Designed to do what?
Well, it's my belief that they are trying to be the party of white people and make the Democratic Party the party of African American or people of color. We think that's very unfortunate.
What does this race portend? As you said, we have a gay black male trying to challenge you for your seat. You have here represented Morningside and the north side of town. You're now trying to engender votes in the west side, the black part of town. Difficult transition, or how do you look at that?
Great learning experience. I didn't choose it. When you get handed a lemon, you better make some lemonade or go away. And so it is an opportunity to bring various parts of our communities. They're all wonderful in-town neighborhoods with some similarities and some differences. But it's a great opportunity for us to learn about each other. And isn't that what we ought to be doing?
There are those who suggest in contemporary political times that perhaps the black community is at the level now where they don't necessarily vote for somebody who looks like them, but somebody who may think like them. Is that very well for you?
I believe that's true. I mean, we've lived in Atlanta for nearly 40 years. I've lived in the same house for almost 40 years. And there have been tremendous changes where communities come together. They are more integrated than they have ever been. I'm proud to be part of a multicultural, multiracial environment. I mean, that's where I choose to live. I grew up believing that you celebrated differences rather than try to exclude some for others. So this sort of fits with who I am, and I look forward to serving what I guess could be argued would be two parts of the district. But we are linked together in downtown Atlanta, and I think it's going to be an exciting opportunity for me.
What does this mean to Atlanta, to the state legislature, and most importantly to you?
Well, I mean, it means that we can go forward.
With regard to, when I ask that, I mean, with regard to how does this play out politically?
Well, I mean, I don't think my legislative philosophy is going to change very much. Since the Democrats are going to be a clear minority, what we need to be is at the table early in the process so we can influence the decisions that are made by the leadership in the Republican caucus. And that's one of the things that I believe that I am skillful at. I'm willing to be at the table. I'm willing to sit and give my ideas early in the process and then continue on to find a solution. I mean, rather than getting up and talking to the press, I prefer to look for solutions and work in the trenches.
I said earlier in the introduction, you're seasoned and savvy. That means something when it comes to making laws, does it not?
Well, it depends on what you want to do. Some people are great speech makers. They really enjoy getting up in front of the television camera and talking about what they did. If you're there in the legislative process, you know it doesn't quite work like that.
Right.
We sit down at the table and we hammer out answers to questions. Nobody gets their way. I mean, everybody has to make some compromises. And I believe that sometimes when you get people from both edges of the perimeter, a better answer is somewhere in the middle. So I believe in seeking compromises, and that's what I would like to do and continue representing the 57th district.
And you have some key committee assignments. I mean, the positions you hold are, for a Democrat, are almost unprecedented with regard to this legislature now, right?
I'm very lucky with my committee appointments. Thank you for mentioning that. My favorite clearly is the Appropriations Committee. You know, the only thing the General Assembly really needs to do is approve the budget. And the subcommittee that I serve on is the one that deals with health issues. What happens with our Medicaid program for those who need health care? What happens with the state employees' health benefit plan? We've all watched tremendous changes in health care. And there's going to be a lot more changes. We know the federal government is looking at serious reform. They've passed a very monumental bill. I mean, I've waited 50 years for this bill to pass. But a lot of what happens with federal reform will be implemented at the state level. And the real reason I want to run again is that I want to be at the table when those reforms are interpreted and implemented in the state of Georgia. I mean, the governor did appoint me to be on his health insurance exchange committee, charged with the responsibility of figuring out how Georgia was going to set up a health insurance exchange, a marketplace, if you will, for small businesses. We need to do something to help small businesses get health insurance for their employees.
So you're at the table then with some clout influence on how money is spent, or how taxpayers' money are dispensed with regard to health and human services.
Well, I certainly hope so. That's my goal, to be at the table and to be able to influence, because I do my homework, I show up every day, and I believe my interests, particularly as a woman, we know women control our healthcare system, and so I have had personal experiences with dealing with the healthcare system, as have most women, and I believe that's important to be at the table, and I would like to be the one to bring it there.
Healthcare, as I understand it, almost what prompted you to get into politics initially. Can you talk about that? That's why you're where you are, right?
It is true. When I was a young mother, my daughter had some pre-existing condition that we found when she was about 2 years old. About the same time, my husband decided to go into business for himself. So it became my job to figure out what kind of health insurance we could find. Well, I shopped everywhere, and no one would cover this child for this condition. They'd cover the rest of the family. It didn't matter how much you paid. They simply were not going to cover that condition. Well, that made me angry, and I guess my Irish temper took over, because it became my personal agenda to try to fix a system that was broken for the people who needed it the most. And I guess I've spent a great deal of my career working on making sure that people can get access to health care when they need it, especially those who don't have good policies in their workplace, or who lose their job for no reason of their own.
That's still your passion.
It's still my passion, I must admit it, and it's very exciting to me that with the new Affordable Care Act and President Obama's initiative, we have definitely made some strides that I've waited a long time for, and I want to make sure that we don't go backwards.
Could your daughter get health insurance now, based on some of the work you were doing?
As a child, she could, and in 2014, all of us can. So these are important changes, and I don't believe that we're going back.
You've also spent a considerable amount of time, your career as an executive director of the Georgia Psychological...
Correct.
Is that...
Georgia Psychological Association.
Which also suggests you're really immersed in this self-care stuff.
Well, I am. I spend a lot of time advocating for mental health services as part of a basic health care plan. I think it's important. We're now becoming increasingly aware of all the health conditions that we have some behavioral component. I mean, we know we need to exercise more, we need to eat differently. There are a lot of things that we know that if we could change our behavior, it would improve our health stats.
So how would you, being re-elected as state representative of the 57th district, impact my health care, my family's health care? I mean, there's a correlation between your going back and improved health care in our various communities?
Well, I can tell you about one specific thing I worked on. Eligibility for Medicaid and Peach Care is a very convoluted process, and I went over to the DeKalb DFACS office and watched them try to work two old computers and make it work, and wondered why people were turned away from getting access to Medicaid. Children, these are children and pregnant women. And so I was tasked with a working group to come up with a plan. And what has resulted is that the governor put in money for an eligibility system, $10 million of bonding to bring down $90 million of federal funding so that Georgia will have a first-class eligibility system, and we will not be wasting money. I mean, the real problem was that you would bounce from Medicaid to Peach Care and back, and every time these companies would charge you for that. So we were wasting taxpayers' dollars. And the purpose of this particular agenda was to see whether we could make government more efficient. And I believe we achieved, or will achieve, that goal. We'll see.
To achieve that goal in this day and age, you spanned the time when Democrats controlled the state legislature.
I did.
And now Republicans are in charge, ruling the roost, as they say. But having that experience as a Democrat in power and now a minority in the state house, can you cross the aisle? Can you get things done? Or are you like many others, impotent in terms of getting legislation passed?
Well, you know, as a woman and as an in-town liberal, I have always been in the minority in the Democratic Party or the Republican Party. So frankly, I don't think it's dramatically different from me. You work with the people who are in charge, who will listen to your ideas, and you figure out how you can make a difference. So yes, it's dramatically different. There's some things, some bills that we talked about this legislative session that were horrible. I mean, they really were horrible.
But I think I hear you say you can still get things done.
I can get something done, that's for sure. And that's why I'm running again.
Many people suggest that getting something done really is important to them with regard to MARTA, and that's been one of your chief pet projects and pet peeves as well. Can you talk a bit about that? What's happening with MARTA and what you can bring to the table in that regard?
Well, as a member of the Transportation Committee, we had lots of bills that treated MARTA rather peripherally. They were major investment procedures for us to tax ourselves to improve on transportation. As a part of each of those bills, I went back and did some research, but there were at least 4 amendments on those bills in the committee, which is the appropriate time to amend a bill. In the committee, I would push an amendment that would take away this 50-50 that has plagued MARTA. You know, 30 years ago, it may have made sense to set aside 50% for operations and the other 50% for capital improvement, because we hoped that MARTA was going to be able to expand. The reality is that Gwinnett and Cobb both turned us down, and Fulton and DeKalb are left paying a 1 penny tax to keep MARTA going. Now, whatever we do with transit, we need local investment in order to get major federal dollars, which is how MARTA got started. And so we continually, I worked with the MARTA folks, trying to figure out what would help them. We managed to get the 50-50 taken out several times. The leadership always put it back in. In the end, they reached a compromise. The compromise was to relieve MARTA of that 50-50 for 3 years.
And that 50-50 means?
50-50 means that we, as the state, are limiting how MARTA spends its money. It's an insult. I mean, MARTA has professional directors who know what they're doing and need to manage their business carefully. It's a terrible business model. There's no question about that. But Marta is 30 years old. As Beverly Scott says, she's an old woman now, and she needs some maintenance. So the idea of expanding is not as realistic as it was 30 years ago. So Marta needs to be relieved of that limitation. And 50% currently, because we did not pass the relaxation of the 50-50, 50% still has to be spent on capital expenditures, which are new things as opposed to operations.
We talk a lot about, you mentioned about women and the impact of not having the impact they should perhaps in the legislature, but also they're the key voters. There seems to be an imbalance between the impact women have at the polls and their numbers in the State House.
Well, there's no question about it. We know 51% of the voters are women. In the General Assembly, 19% of the members of the General Assembly are women, and that's simply not enough. I mean, the debate changes when a woman is sitting around the table. There's no question in my mind about that. And we desperately need more women in the General Assembly and in leadership positions of all kinds.
Finally, your cynics, your critics will say, well, this lady's been a representative in town and Morningside for years. How can she now transition and represent lower income and ethnic communities, and does she really have it? Can you do both? Can you make that stretch, if you will? Is that palatable to do?
Well, I've been representing in-town communities north of downtown for 11 years. And the issues I have been working on have to do with helping people get access to Medicaid, helping people who need our help the most get access to what's going on at Grady, particularly the mental health services. So my agenda hasn't changed, my value system hasn't changed, and the people that I have been represented honor the fact that we're working for issues that will help all of Georgia's citizens.
And a state representative is important to my life, their lives, for what reason?
Well, we make rules that impact on your daily life. How fast you can go, do you have a policeman to take care of you when you get into trouble? Whether you can be licensed as a photographer or licensed as a doctor. I mean, all these decisions are made at the state level.
Ladies and gentlemen, this has been, like I said earlier, seasoned, savvy, and sophisticated. Her name is Representative Pat Gardner, District 57. I'm Maynard Eaton, Southeast Region News.